Welcome back. You're at the second last session in the program. Today we are going to discuss pain flare-ups and the things you can plan before they happen. But for now, we'll do a brief check-in. Gently close your eyes and give your breath your full attention wherever you feel it most. Savor the out-breath when it comes around. Let's think about tension. Have you been able to use the out-breath in your day-to-day life? Have you ever used it when you noticed you are upset or unsettled? What about pain and anxiety? Have you been able to link pain to stress or anxiety? Have you ever caught yourself catastrophizing? Or thinking in black and white terms? Were you able to use the out-breath to get your thoughts back on track? What about feelings? Are you able to notice your reactions? Have you used the in-breath to welcome feelings and the out-breath to release them? What about values? Reflect on a choice you might have made that moved you towards your values. Have you made any choices recently that have moved you away from your values? Think about that choice. If that moment came around again, what could you do to move yourself towards your values? Developing a specific plan before a pain flare-up occurs allows you to work out a practical and effective strategy for yourself while you're thinking clearly. Trying to come up with pain strategies and solutions while you're in the middle of a pain flare-up is not an effective space to work in and is likely to add more stress to your situation. Also, if you get a pain flare-up and have no plan, then it's likely you'll resort to quick short-term strategies, things that might not work well for you in the long run, things that might move you away from your values. Having a plan ready also allows you to review it, refine it, work out what worked and what didn't work, and what can be improved. Over time, you will then develop the most optimal and effective plan for yourself. This means you won't leave your recovery down to chance. In our intervention now, we're going to reflect on a few key reminders. These are things you can think about and include in your pain flare-up plan. We're going to do this exercise in the same order we do our 5 breath exercise. First, we'll look at tension, then the pain sensations, then thoughts, feelings, and the body as a whole. Focus on your breath now. Give the out breath your full attention for the next few breaths. Visualize yourself now in a situation where you're in a pain flare-up. I'll present some questions that you can reflect on while in this state. Reflect on these questions. Can I experience this pain without experiencing tension in my forehead, neck, and shoulders? Visualize yourself releasing those areas. The next question is, do I have the tools to notice and release pain fear? Visualize yourself noticing and releasing pain fear. Checking in on your thoughts can be helpful too. Is my pain affecting my thoughts? Am I catastrophizing? Am I thinking in black and white terms? Now take a moment to reflect on the difference between these two questions. The first is, why do I have this pain? The second is, how can I manage the pain? Reflect on how each makes you feel. Here are another two questions. The first is, what can the medical profession do? And the second is, what can I do? How does each make you feel? Notice your feelings. Are you reacting to your feelings in some way? Can you invite your feelings on the in-breath and release them on the out-breath? Visualize yourself doing that. Visualize yourself releasing tension in your body as a whole, even while you're in the middle of a pain flare-up. Are you now in a situation where you can move towards your values? Visualize yourself doing that. I'll leave you with one final question. Is it possible for you to experience pain and joy at the same time? I'll leave you with an excerpt from the poet William Blake. Joy and woe are woven fine, a clothing for the soul divine. Under every grief and pine runs a joy with silken twine.